Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here helping employers and health systems work around population health and improving the health of their employees. So, Nick, big announcement this week. Everyone been waiting for it. The president holds a press conference and brings out his path out of the pandemic, the COVID-19 action plan. Now, let me start out by saying we're not attorneys. We don't know the legalities of this or the constitutionality of these decisions. There are certain to be lawsuits. We've already seen that announced. But within this, there were 6 areas of focus, and we're going to dive into a few of those today, just a couple. There were vaccines, booster shots, schools, testing and mask requirements, economic recovery, and improving care for those with COVID. So 6 in total. So first off, Nick, why now? What made it that the president said, I've got to come out with this really substantial package?
Well, aside from the fact that I think he said we've had enough, um, and I think he's channeling all of our thoughts around this. We felt like we had a pathway out. Um, we've had the tools. We've known what to do since 1920, whatever it was. We've got additional capabilities. Yet, despite all that, we've seen this recurrence, and we were all opening up, and then suddenly we're back in. And I think it's moved from individual. I keep hearing my individual rights. But at some point, your individual rights are overtaken by the group requirement for the better community, the health. There are things that we don't like doing. And, seatbelts is often one that's used as an analogy here. And we're at this point. We're mandating seatbelts. You have to wear a seatbelt in the front of a car. Actually, I think you have to wear it in the back. I think we're the same here, right?
Yeah, and I think also what we've seen is this huge amount of hospitalizations and deaths. And these are preventable. Much of this is preventable with vaccinations. So let's start there with vaccines. What did they do? And these are just a few of them. They mandated it for all federal workers and their contractors, which is interesting. I'm hearing some responses, obviously, from the aerospace industry and others. Employers with 100 or more employees. Now, this is not truly a mandate because there's an opt-out. Weekly testing is required. It's going to be an OSHA emergency requirement, but the devil again is going to be in the details. Who pays for these tests? But it is framed appropriately. It's protection for the workers. They're going to require vaccinations of all healthcare workers. And in the short paragraph, not fully announced, I did not see an opt-out provision here as was in the employers over 100. Your thoughts on these?
Well, so again, treading carefully on personal rights, but the greater good here, I think, is the prevailing wisdom. I think people bristle with any kind of mandate, but the reality is, if we're seeing this failure, and you only have to look around to see people's reaction to some of the mis and disinformation that is flooding the space. And I have some very personal stories that, I hope we'll talk about in future weeks, Fred, that essentially we have to overcome this and finding some pathway to a mandate. And in fact, with the get out in the case of some of them where you can test instead. So I'm going to protect others by making sure that I don't. And to be clear, they're only testing once per week. And, there are some instances where we might say 2 or actually 3 times per week. And, everybody gets worked up and they're finding resistance to that. But the reality is, don't we all want to be open? And we know the safety record of all of these things.
Yeah, I think you're right on target. This is about an economic recovery issue. I can't tell you how many small businesses I've interacted with in Jacksonville that have had to close because too many people were infected. That's an economic problem. And then you add on to that potential issues with those people getting hospitalized and healthcare costs or having to see their doctor or monoclonal antibodies. And suddenly you're racking up expenses, economic output, etc. So I think this is an interesting idea. We'll see how it goes. Obviously, your point about 1 test a week versus 2 or 3 is an interesting one from a scientific approach to watch over time.
And see I know I'm going to be popular for that, right? Oh, next.
For sure. You'll probably get a few comments and we might see see a few things flying through about this. So let's get on to another area that we've discussed before, and it's fascinating to see it. It's been pushed for a long time, this idea of rapid testing, at-home expansion of testing, affordability. They're saying maybe Amazon, Kroger, and Walmart will sell these at cost for individuals over the next 3 months. What does this get us, Nick? And why is that important?
Well, so let's be clear. As part of this whole opening up, you can't just say, at cost is great. That's better than where it was. And, those that track anything, I posted my $350 test bill that I got that, I fought and ultimately disappeared. But, that's competing with the public good. And this is a public health requirement. I'm saying you need to be tested. My view, and I'm, in conjunction with some folks online, Michael Mina is one of the folks that I see, this should be free. There should be zero cost to this. We should make it widely available. We're asking people to do it. And if you want people to take the right decision, they have to have access. And okay, so you can go buy those tests, but what if you don't have it? If you're in one of those groups that can't even afford to buy your medications or your food or pay for, the roof over your head, we're saying, oh yeah, just spend another $20 or whatever it happens to be. That's a lot of money. And I just think this is wrong. We have to make this available. It's part of the Swiss cheese strategy that everybody talks about, and it's essential.
I think you're right on target with this. And when I came back from HIMSS, actually, I bought a couple of kits. I bought two actually, and I used them over about 5 days just to ensure and quarantine myself back in the room that I was not infected coming back from that event. And it's interesting now, you can't find them. I go to Amazon, I can buy a case of these over 1,000, but I can't buy the individual kits anymore. And I think they're talking about using the military, some of that approach to get industry to produce a lot more of these so we can get them out. Obviously, it's important that we get them to everybody who needs them, and price is going to be an issue. Hopefully, there's some other distribution strategies they have to solve some of that problem that doesn't require an individual to go somewhere, but allows them to get them to their house and do them at their home where it makes it easier. Anything else you can think about, Nick, when you look at this situation and what else we might expect from an employer perspective?
I applaud the president and, his team. I think they're really focusing, leaning in on this. There are multiple elements, as you rightly defined. I think not all of it is exactly right. And, I think we have to keep moving in the right direction, take as much as we know and learn, and apply that in the right places. And from a business perspective, this is all helpful, I think, in terms of pushing us to that point where we want to be, which is doing all the things that we used to do, quite frankly, without having to wear a mask. But that's going to require some significant progress.
Absolutely. And I'm going to quote the amazing Dr. Nick with one of your great statements: there's never a perfect plan, but there's always perfect execution. So let's watch as we execute this, because I think you're right. There are things that are maybe not needed, other things that might be in, but overall, it's, I think, a great first shot, and we'll see where that goes. So this is Fred Goldstein with Accountable Health. Thanks so much for joining Dr. Nick and myself this week. If you'd like more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.